What is a fetal scalp electrode? Why might you be recommended one? What are the benefits and risks? Firstly, a fetal scalp electrode is a small wired sensor that is placed directly under the baby's scalp during labour to provide a much more accurate continuous measurement of your baby's heart rate trace. For women and people who have twins, this is often recommended for twin 1, who is first in the pelvis. There'll be recommendation for fetal scalp electrode to continuously monitor twin 1's heart rate, and then an ultrasound for twin 2 to ensure that there are two distinct and differentiating heartbeats. There can be many reasons why this is recommended. Firstly, that there is loss of contact with baby's heart rate. This is more common if you are somebody who has a much higher BMI. For example, if your BMI is above 40. Ultrasound monitors can be harder to be able to detect and listen and be able to provide a continuous heart rate trace. And in the pushing stage of labour, if the ultrasound probe is picking up maternal heart rate, because what happens in the pushing stage is mum's heart rate goes up and baby's heart rate often drops, sometimes it can be difficult to know whether baby's starting to get distressed and unhappy by that labour and birth, or alternatively whether it's picking up maternal heart rate. And so sometimes a fetal scalp electrode is recommended to be able to decide, is this baby unhappy? And that provides that continuous heart rate tracing. Now, I'd always say with CTGs, continuous fetal heart rate monitors, that you have a long conversation about the benefits and risks, the risk factors for you. Why is it being recommended? Do you want it? Do you not? What will it have impact-wise on your mobility? And also having the impact on potentially being recommended to have that scalp electrode underneath your baby's scalp. Internal fetal scalp electrodes are far more accurate than ultrasound monitors. What that does is enables far better decision making and recommendations to keep baby safe during that labour and birth. How a fetal scalp electrode is applied? Well, it's an internal examination by the midwife or doctor. They find baby's head, ensure that it's not on a soft spot, find a really solid part of baby, and then apply pressure and then twist, and it goes underneath the surface of baby's skin. When baby is born, this is then removed, or if at any stage that it is not working effectively, it will also be removed at that stage. The benefit of a fetal scalp electrode is to accurately monitor baby's heart rate, but there can be some risks with it too. Common risk is that it leaves a mark underneath baby's skin, and that's because it has gone under baby's skin, it has pierced that skin surface. It's superficial and it usually heals quickly. There's also a slight risk of infection as well at the place that it has been put in. For women and people who have HIV or blood-borne viruses like hepatitis, for example, fetal scalp electrodes are contraindicated. They are not recommended in these cases. In addition, women and people who have low platelets in their pregnancy are often not recommended to have a fetal scalp electrode on baby because there's no known platelet count on baby at that stage. And also if you've got an extremely premature baby as well, it's not often recommended. Similarly, it will not be recommended if there is a vasa previa, for example, so that the vessel that is running through the membranes of your bag of waters. It can only be applied directly to a head or a bum. It should never be applied if it was a brow or eye presentation, for example, because of the risks to the baby's eyes at that stage. In cases, it can cause a cephalohematoma, so that's a collection of blood that is underneath the skull itself. And in incredibly rare case studies only, there have been case studies where somebody has attached a fetal scalp electrode to under the eye, for example, and the eyelid, and there has been complications from that. In the rare cases, it's been applied to the soft spots as opposed to a direct solid part of the baby's head, and there have been brain abscesses from it. It's why it's really important that applying a fetal scalp electrode, the midwife who is applying it ensures that it is definitely a head, has a really good feel of the position of baby's head before applying a fetal scalp electrode, can feel something really bony and really solid in the vagina before they apply a fetal scalp electrode. And this is where full consent is incredibly important throughout. Neonatal infection can also sometimes happen after application of a fetal scalp electrode, although it can sometimes be difficult to differentiate whether that was because of the fetal scalp electrode or because of the risk factors that happened in that pregnancy, labour and birth, that the CTG was recommended, so the continuous heart rate trace was recommended because of the possible impacts of infection on baby, which has then led to a fetal scalp electrode later on in that labour and birth. It's about having the reasons as to why it's being recommended. It should only be recommended in certain situations. It shouldn't be used for every single person. It's often only used because there's loss of contact, often because mum is mobile and upright and moving around, maybe because baby's in a funny old position inside. Ultrasounds are not the best at detecting baby's heart rates, and so sometimes it can actually detect maternal heart rate rather than baby's heart rate. And women and people with a high BMI, for example, are more likely to be recommended a fetal scalp electrode, as are women and people who are having twins, and sometimes when there are other risk factors as well going on in labour and birth. The question needs to be asked is, why are you on a CTG? Why are you being recommended it? Do you need to have it? And is it the right choice for you? And are you going to use it?